healthcare access among young men struggling with substance abuse. Every day, people in the United States seek care in the emergency department for a multitude of reasons. Often, patients come in seeking treatment for substance abuse, concurrently, treatment for mental health issues as well. Many of these patients are unsure of where else to seek treatment or are uninsured and cannot get the help they need, and these patients will find themselves waiting in the emergency department for many hours, sometimes days, waiting for a bed to open up or a facility that takes uninsured patients to accept them for treatment. The research tells us that alcohol and drug use is more common among males, with almost 40% of high school males reporting alcohol use and 25% reporting marijuana use. It was also found that adolescent males are more likely to die from suicide and have increased risk for suicide attempts. Another study found that the emergency department is often used as the first point of contact for patients seeking mental health and addiction treatment, and often used as a replacement for outpatient treatment. My question remains, does substance abuse affect access to health care for young adult males? Males account for a significant number of patients who require treatment for substance abuse. In 2019, it was discovered that 65% of admissions to publicly funded substance abuse facilities were males over the age of 12. 40% of those admissions being males aged 12 to 34. According to the National Institute for Health, men who abused marijuana were more likely to abuse other substances and had a higher severity of substance abuse. They also state that in regard to heroin use, men are more likely to inject heroin and use larger quantities than women. They also found that men were more likely to abuse alcohol and more likely to binge drink. So where are these patients seeking treatment? The emergency department is often the first point of access for patients. Ideally, the emergency room should only be used for high acuity situations where safety of the patient or others is a concern. But more and more often, people are seeking treatment in the ER prior to seeking outpatient care. But access to mental health services is often limited, not only by long wait times, but by other barriers such as insurance requirements. In 2010, it was found that almost half of adults with a mental health-related ER visit have no mental health outpatient care in the 2 years prior to their ER visit, even though they present with lower acuity of symptoms compared to those seeking outpatient mental health services. The difference between the number of people who receive treatment for addiction and the number of people who need treatment for addiction is vast. Research tells us that the people who report poor health, severe pain, having gone to the emergency room, having had sexual high, or used injection drugs, are more likely to experience unmet healthcare needs. One of the most important considerations when discussing access to healthcare is barriers to care. Obviously, with this group, economics is a significant factor, whether that be the cost of insurance or co-pays. Other considerations are that patients who are actively using drugs are less likely to seek treatment, but patients who had previously been treated for addiction were more likely to enter treatment again. One study regarding HIV prophylaxis treatment found that patients experience many of these barriers, including lack of access to healthcare facilities where they can learn about PrEP therapy. This is a major concern, as 1 in 36 men who inject drugs will be diagnosed with HIV in their lifetime. Another barrier that can be considered would be race. Studies show that Black emerging adult males are less likely to participate in treatment for substance abuse due to a mistrust of the medical system based on a history of racial bias. We must also consider the lack of knowledge among healthcare providers and the stigma around substance abuse. A study in Canada found that although there were over 138,000 participants eligible for naloxone prescriptions, only 1.5% of those patients received a prescription. Shockingly, the study found that having a previous overdose on opioids made patients less likely to receive a prescription for naloxone, even though these patients are at a higher risk for overdose death. Based on what we know so far, we can answer yes to my question, does substance abuse affect access to healthcare in young adult males? We can see further proof of this in one such study that compared the services received at a primary care office and a substance use disorder clinic. In the 12-month period leading up to the study, participants in the substance use clinic reported discrimination in a healthcare setting. It was also found that men were less likely to receive annual screenings such as prostate exams. Finally, we must ask ourselves, how can we as healthcare professionals combat this issue? The first step is to address your own biases. Reflect on your values and how these biases might impact care. Next would be to find ways to ask patients about their drug use or mental health concerns without causing shame, whether that be through a questionnaire or something similar, and become comfortable having open discussions with patients about sensitive topics. Finally, make it standard practice to ensure that your patient has all of their needs met for a safe discharge plan, such as providing information on free Narcan. Don't be afraid to collaborate with your team in ensuring your patient has all the resources, such as social work for safe housing or crisis workers for mental health referrals.